I'm Kelly Springer, and I wanted to introduce you to the amazing Emily, and she's doing so much. So, Emily, tell us a little about how you came to Kelly's Choice, because it's a really fun story.
It is, yeah. I was working as a clinical nutrition manager at a hospital and nursing home, and I actually worked in the same hospital as Kelly's husband. And so we had a connection there, and I had saw her at a conference, and she said, "Why are you driving to that hospital? You can work with me for me in Skaneateles." And I said, "Okay." And then I worked for her that Monday.
It's been such a fantastic relationship, and just being able to work next to you because you're local, not everyone is local, and what a different feel that is.
Yeah, it's amazing, and it was the best choice I ever made. So I'm very grateful.
Thanks. So tell all the things you get to do because you don't have just an ordinary contract job. Like you get to do a lot of things.
Yeah, so my job is really different every single day, which I love. I do see clients full time on the private practice side, so I have a full clientele list from 15-year-olds to 85-year-olds. I see a lot of different conditions, and that's really cool. Keeps me on my toes and up to date with current research. I see people telehealth and in person, so that also is a nice little variation. But I also do all of our onboarding and outreach. So I look for new RDs and I get them on our team and welcome them and get them going to start seeing their clients. So it's a lot of fun, a lot of different things happening, but it keeps me busy in the best way possible.
It's the best. So I love that. And the fact that you're in it and then can train on it, I think it can help the dietitians a lot because it's not that you're just here as an admin, you're physically doing the work. So you're able to teach them how to do best practices.
Yeah, and it's really like a peer-to-peer relationship, and that really is helpful. Like the RDs text me or call me with any issues, and they know that I'm going through the same thing. Like we are a team together, and it's really great. The relationships that we build are really great.
So we're growing.
We are like exponentially. Yeah.
So
Fast.
fast. So we're bringing on more dietitians. So if there's any dietitians that are watching this on LinkedIn and or on YouTube, definitely reach out to us because we are bringing on a lot more dietitians. And that is because of the relationships that we've built over 14 years and new relationships that like talk about some of those, Emily, because you've been doing a lot of those too.
Yeah, so we really have been building relationships with local physicians' offices, specialty offices, but also like making connections far and wide. Like we have those connections in Hawaii now. So also RDs listening, I don't care what state you're in, reach out to you.
Exactly. But, it's really interesting when we show up, right? And this is something that I think makes a difference that Emily, you went out to Dr. Jason Sloan's office and presented to their diabetes group. And it took a couple of months, but he started sending a lot of people. Now we're getting their weight loss clinics. And so it's really interesting of building the relationship and then also doing such quality work for people that the doctors then trust us and know to send to us.
Yeah, and it's so rewarding too, especially as a dietitian, like going to that diabetes support group and presenting and hearing how grateful he is for our services and the success stories and testimonials he's heard from working with us, from his patients working with us. Like that is one of my favorite parts of the job. Upstate cardiology, like the St. Joe's primary care offices, like all these
Yeah.
physicians I get to collaborate with. It's really, really awesome.
It is. It is. And yes, we met a really, really awesome Dr. Madison Healy not too long ago at a lunch and learn. And she's just been such a huge, huge supporter of what we're doing in the way of women's health as well. So for anyone listening, we see, like Emily said, we see the whole gamut from people on GLP-1s, women's health, diabetes, weight loss, sports nutrition. Talk about our sports nutrition. You brought on some awesome
Yeah.
people.
So we now have two PhD students from Ole Miss that are registered dietitians working for us, and they're killing it. They do amazing work, and they're just the brightest, most bubbly Southern souls. But they are doing incredible work with our sports programs. So we're hoping to launch those coming soon to local, high school, college athletics. But yeah, it really is amazing how many different avenues you can go into working with us. Like we have different specialties and we have clients for everyone. So, whether you do renal or weight loss, it's all, you're not going to have the same day every day. But if you say, like, this is really what I love, that's what you get. And it really makes it the best for the RD and the client.
Yeah, absolutely. And we take interns.
We do.
Another
Oh,
whole thing. Yes, we take them both in person and virtually. So we have one of our interns has been with us for a very long time. She's just finishing and going to be wrapping up into an RD and going to be coming out with us, Miss Amazing Molly Schwartz. So she starts with us again tomorrow. But a lot of our interns become our dietitians.
yeah, and it's awesome. And whether you want to be a dietitian or you want to see like from the entrepreneurship side or you want to see from the marketing side, like there's so many different lenses. Kelly's a woman of all trades. I don't know when she sleeps, really.
Well, it's a good team support. So now we have built out over the last few months, which is really cool. We've built out a whole team of registered dietitians that are also doing some management. So that is cool. That's new. So tell us about that, like how, because I think that that's amazing.
Yeah, and it's really been an incredible experience to watch how fast we've grown since starting that kind of initiative at the beginning of the year. Like, I remember you called me like right around New Year's and you were like, going into the new year, this is like the plan. And really, it has done nothing but lead us to success and those higher numbers. But yeah, there's four of us, about to be five, full-time dietitians on private practice that have administrative roles, and we all kind of take a little bit and work together. And we work from, medical office outreach, referrals, building those relationships with the providers, how we obtain more RDs, how we grow from that side, how we, not only obtain clients, but how are we retaining them? What can we offer in terms of CEUs? And we all take a little bit and a piece of the puzzle, and together it's just really working incredibly. So,
Yeah, I agree. I think being able to split up our clinical stuff and doing a little bit of management just helps to break up the day and also brings us together. So we're getting together every week and talking about, the good things about medical billing, the bad things about medical billing, all of those different aspects. So we're able to kind of, because you are all working in the field, you're able to come back and say that claim didn't go through, or why did this person have a copay? And so it's really nice. You're not just management, you're not just sitting over top, you're actually doing it, which I think is really right. It makes a big difference.
it does. And it really does help, like you said, to break up the day and kind of get out of the, constant routine of, okay, meeting with clients, counseling, charting, all of that RD work, which obviously we all love and that's what we train to do, but it does add a whole different element to it that keeps it exciting and does definitely make that teamwork feel more connected.
Yep. I agree. I agree. And it's been really cool to see. And it hasn't been that long that we put it into practice. And it feels
Yeah,
like it's becoming a well-oiled machine. So
it
that's
is.
been
Every month it's like, okay, numbers are up, numbers are up, numbers are up. And now it's like, okay, Emily, hire more. Like,
I know. And it's been fun to get just such quality dietitians on our team and being able to
yeah,
build that. And I think something too, which is cool, because there's a lot of people popping out of the woodwork right now because of the GLP-1s, but because we are a dietitian owned, dietitian run company, and truly all the RDs are running the company, that we are differentiating ourselves in the space.
yeah, 1,000%. And I have so many clients, especially the GLP or weight loss clients that come and after one session, they're like, this was nothing like I expected. This is like so much better. Like I think they expect like going into a doctor, like do this, don't do this. But our like RD initiative at Kelly's Choice of like building that balanced lifestyle, sustainable changes. Like people appreciate that. And it's always nice to see them surprised on the other end of like that's
Mm-hmm.
what we did here.
I agree. People have no idea what they don't know. And now almost all of it's covered by insurance.
Yes, and that is another thing a lot of people don't know. That's why now I keep business cards with me everywhere. As soon as I'm in the middle of any group, I'm like, did you know you could see a dietitian for free? Here,
Right.
take
Here, take a card. Here at the Spectrum store, right?
yeah, in the middle of the Spectrum store. I was like, I literally can help all of you. And then by the end of the day, she was like, yeah, I'm going to see you for high cholesterol and I'm going to see you for weight loss. I was like, see? And none of you are going to pay.
It really is an incredible time, and we're trying to get this word out and shout it out. So if you're watching this and that was news to you, please share share this out to more people. And then Emily, you're also doing a lot with work sites. So talk
Oh,
about
yeah.
some of the companies you've just been seeing, because and tell what you do with them, because I think this is something a lot of people want to know more about.
Yeah, so one of my favorite parts, I can't believe I left that out of my what I do. But I do our workplace wellness presentations. So Kelly had created this transformation program, which has really been nothing but successful from any condition. It applies to absolutely everyone. I advertise it as saying, I could tell you what to eat all day long. This is the comprehensive guide of why you're eating what you're eating and how it applies to you. So it's really a whole background knowledge on nutrition and nutrition education. So it's a 12-week program, the first 12 weeks. We now have 24, but the phase one is 12 weeks, and I meet every week, same day and time, with different companies and talk to their employees about this nutrition education. And then I even have a company right now that's doing the phase two. So they did the first 12 weeks, loved it so much that now I'm doing their second 12 weeks. But it's super rewarding. We send out like surveys at the midpoint and the end. I've had people lose like 20 to 30 pounds in these 12 weeks. I've had people just rave about the program, how they feel so much better. They're so much more confident going to the grocery store, bringing lunch, what to make. Their families are enjoying it. And it's really incredible. I see from financial groups to trucking companies, like
Yeah.
I see it all. And it was interesting. I had one of our interns was watching me this past week do the transformation programs, our workplace wellness. And she said, I heard like you get such great reviews on workplace wellness. Why do you think that is? And I said, I genuinely think they can tell I'm excited, but also I always make sure to relate it to them, right? Like someone who's driving a truck for 12 hours a day has very different nutritional, circumstances than someone that sits at a desk for 12 hours a day.
Right.
So individualizing it, making them feel like they're seen and they're heard, and you know, making that special for them really makes a difference. And I think you can just tell I love what I do.
Absolutely, absolutely. And like you said, we are in all different types. So people ask me all the time, audience are you going after? And I said, no, it really is everyone. It's, little teeny companies to giant companies. So, we're serving everyone from Rochester City School District to ESL to EY, which is enormous, to, like you said, transportation systems like RTS. So lots of different groups that are coming on with us, banking systems, I mean, everyone. So truly everyone can benefit. And if you are a company, if you're in HR and watching this, definitely reach out to us. We can help you to lower claim costs and get your people onto a healthy trajectory. So lots of fun things that we're doing here, right?
Yeah, love it. Everyone eats one way or another. So everyone can learn something.
Everyone can learn something. And it does make a huge difference. So, like we said, a lot of the private practice is covered by insurance. A lot of our workplace wellness groups can actually be covered by wellness dollars from insurance as well. So that's a huge bonus benefit. So yeah, we're getting those dollars from MVP, United Healthcare, Blue Cross Blue Shield, Aetna. So lots of different ways that we can work with organizations too.
Yeah, it's awesome. And my favorite is when I have people that were part of a transformation program in their workplace wellness and then they stay on. to be a client. That's like always my favorite. And they just want to know more. And that's how I feel like I rope them in.
Yep, absolutely. So that's where we can work on that general group setting or really truly focus in on their personalized nutrition and work with their physicians' offices. So our platform has an EMR built in so we can connect in, which is really great, right? To get in with.
To be able to see labs and communicate with providers and discuss, collaboration of care and care goals. It really does. It's in the best interest of the client and the patient, and it really is awesome to have that information.
Mm-hmm. It is. Anything else you want to share?
I don't think so.
I know it's a lot. We covered a lot. So dietitians reach out, HR, vice presidents or presidents of an organization. We want
Yeah,
you all.
seriously, no matter what you do, send me an email.
Yes. And what is your email so we can
It's
get it out there?
Emily@kellyschoice.org, all lowercase.
Pretty easy. So reach out to us, and definitely you can go to kellyschoice.org and you put in the contact information page.
Mhm.
That's a good way to reach us too. You can book right online on Kelly's Choice. You don't need a doctor referral to see a dietitian. So that's also pretty cool. So we'll share this out to as many people as possible, but please reshare this and get this out. And Emily, thank you for your time and all that you do for Kelly's Choice.
Absolutely. Thank you so much for having me.
Thanks, everybody. Have a great day.